Hello, my name's Chuck Barbera. I come from Reading Hospital in Reading, Pennsylvania. We are really a mix of both a community and city hospital. We are the largest emergency department in the Commonwealth of Pennsylvania with over 135,000 ED visits a year. We have about 130 beds in our emergency department, and every day we see between 80 and 120 ambulances that come into our department. The reason why I say this is this not advancing? Are they?
You're going to have to go yourself.
Oh, okay. The reason why I bring this up is because Tower is part of a big health system, but the reason I bring this up is because we now have partnered with our colleagues in paramedicine, because what we've noticed in the community is that the paramedics tend to know these patients and our patients more than we do in the hospital. And so we serve a population of close to 500,000. Again, we talked about the trauma center and the outcomes, but I wanted you to meet a patient. This patient is Jay. And Jay is, as you can see, a U.S. Army veteran from the Korean War. But by the way, Jay has had 16 emergency department visits in 1 year. This is from last year, and it was only June 15th. He's also had 10 hospital admissions and 2 admissions to the observation unit. Let's look at his past medical history. All right, he's had an MI. He has congestive heart failure. He has type 2 diabetes, coronary artery disease, depression and anxiety, chronic obstructive pulmonary disease, frequent UTIs, and post-traumatic stress disorder. Why does he keep coming back? And this is where we partnered with our paramedics. So we looked, and case management, we went and we looked at every discharge that he had. And he always had a PCP appointment on discharge. He always said, yes, I understand, and I'm going to go to my appointment. He hadn't attended a follow-up appointment in over a year, and his PCP will no longer give him an appointment. How do we label a person like him? Well, the staff would say, oh, he always comes because he likes the meals. He likes it here. He's lonely. He just needs a week of rest. He does have a bad disease. He's non-compliant with his meds and his diet. He just doesn't get it. In the hospital, he verbalized understanding. He knew what a low sodium diet was. He knew how and when to take his medications. He said he would go to his doctor's appointments. We just couldn't figure out what was going on with Jay and why Jay kept coming back to the hospital. So what we did, as we do very well, at least at Reading Hospital, is we labeled him non-compliant, and we wrote him off. We said, okay, Jay, you know what, you're not playing by the rules we want to play with. And then one of our paramedics, who goes to his house every time, said to me, Chuck, let's do this. Why don't you let me go out to his house and work with Jay? So we went to the foundation of the hospital. We got a grant to fund a community paramedicine program. And this is the reality. The reality was that Jay was a homeless veteran, and the reality of his situation forced him to move 30 minutes away from his PCP's office. So he had no way to get to his PCP. He was ashamed, and he didn't admit that he just didn't have the bus fare. So when the doctors and nurses would ask him, he would say, okay, okay, okay. The pharmacy was within walking distance of his house to get his meds, but he was so short of breath he couldn't even walk there. And he got his meals from the local food bank, and what we learned about our food bank is the food bank generally deals with donations, and a lot of the food that they give out has a lot of sodium. Now, he's got a history of congestive heart failure. How do you think that works? So the paramedic went out and looked at all these things. You know, the medical care is so important. It's so highly valued in our society. The one thing that's important to know that we notice is your zip code is a much higher predictor of your health than your genetic code and where you live. So what we did with Jay is we went out and we started a program with a paramedic that we went out to Jay's house, and we went out twice a week, and we weighed him. We took him to the pharmacy. We got him a new PCP that is down the street from his office. And what I'd like to show you here is in the blue is all the interventions, all his visits to the hospital prior to the intervention of the paramedic, and then afterwards you can see how much it decreased his utilization of the emergency department.
We're at 5 minutes, so we're going to go ahead and move on. Thank you. So now that our judges have a microphone. Yeah, thank you. I know we're having some technical difficulties, but thank you. Well, our next presenter, Hurricane Matthew, is coming up. If we could get a few quick comments from the judges about the first two talks.
So, Shan Yu, the initial talk on the myth of the mechanical fall, amazing use of slides, beautiful images that really coordinated well and kept up a dynamic pace. I thought that was pretty fantastic. None of the slides were too busy. Really important message that was delivered in an incredibly effective manner. Occasionally there might have been one slide that was a little busy from time to time, and there was a lot of material to cover in that, but overall, fantastic job.